registered for the event today, which is fantastic. So for that reason, you guys as attendees have got your cameras and your microphones disabled. So you should just be able to see and hear the presenters. However, we do really want to hear from you, and in particular get your questions for the question and answer session at the end. So for those of you familiar with Teams, you should be aware that there's a chat function. So please do pop your questions in the chat. If you're more used to using a different system, if you hover your mouse over the screen, you should get a number of icons at the top, and there's a little speech bubble there, which is the chat option. If you click that, it should allow you to type us a few questions, and we can pick those up at the end. We are going to be recording today's session, and for those of you who aren't able to make it live, we will be emailing both the video and the resources out to everybody who's registered after the event. And the video and the tools and resources themselves will also be shared via social media following the event today as well. I think that's all of the housekeeping, and it looks as though we've got a really good number of you attending today. So without further ado, I'm going to hand over to Sarah Peretta, who's going to kick us off from the Money and Pension Service.
Thank you, Sarah. Hi, everybody. Thanks so much for joining today. So my name is Sarah Peretta, and I'm the Propositions, Insights and External Engagement Executive Director at the Money and Pension Service. So we think we've got about 200 people registered for this event, which shows the level of interest in this joint topic of money and mental health. I'm conscious that many of you in the health and social care sector may not have heard of the Money and Pension Service or what we do, or might be wondering why we're interested in supporting mental health professionals to have quality conversations about money with the people you support. So I'll just give you a bit of detail on that. So we're an organisation set up by government to help people, particularly those most in need, to improve their financial well-being and build a better, more confident future. So we will work collaboratively with a whole range of organisations across the UK, and our objective is to make sure everyone can access high quality money and pensions guidance and also debt advice throughout their lives as and when they need it. In 2020, just at the beginning of 2020, in those heady days before COVID, we launched a 10-year UK strategy for financial wellbeing, which we developed in partnership with over 1,000 organisations across the UK. And it's designed to drive change at scale and shift the dials on personal finance. So in that strategy document, we laid out 5 national goals for the UK that we want to see by 2030. So those are 2 million more children and young people getting a meaningful financial education, 2 million more working age, struggling and squeezed people saving regularly, so they've got that savings buffer that's really important in an emergency. 2 million fewer people using credit for food and bills, which is obviously an increasingly difficult challenge in the cost of living situation we find ourselves in at the moment. 2 million more people accessing debt advice, ideally as soon as they need it, not sort of leaving it too late. And 5 million people, more people understanding enough to plan for and in later life. So during that strategy development process, we were acutely aware of the fact that people who are struggling with their mental health are also more likely to have poor financial well-being. So we know, for example, from our adult financial well-being survey data, that 74% of adults who've experienced a mental health problem in the last 3 years say that they struggle to keep up with bills and payments. We also know that about half of the people who find themselves in problem debt and access our services also have a mental health problem. So these are really high numbers compared to the general population. And we also know that people who experience mental ill health are more likely to have used high cost credit and to have experienced emergency financial issues such as court summons than people who don't have a diagnosed mental health condition. So because of all these reasons, we made mental health a cross-cutting theme across the whole strategy, and we've been thinking about all 5 of those national goals with mental health in mind. And we recognise that often the best way to reach people who might be struggling with their finances is via people and services that they are already in touch with and who they trust. So that's people like you. Ultimately, the way I think of this is it's a bit chicken and egg. We share the same problem, but from different angles. So we know that if you think of financial well-being as a health issue, we know that if someone is in a position of ill health in terms of their finances and they're entering treatment, in this case, a debt advice process, they will not get better as quickly or at all sometimes if there's a barrier in the way, like poor mental health. Similarly, some of you will know that if someone's finances are in a mess and that is bearing down on them, and this might compound the issues they're having with their mental health, and ultimately that will slow down and impact their recovery. So we have that big shared problem. So that's why we set one of our objectives to work with the health and social care sector in order to really embed financial well-being within health and care services and mental health services in particular. So in that context, we were absolutely delighted to be approached by North East and North Cumbria NHS to work together on the creation of this new tool, which we hope will help you as mental health professionals be able to have appropriate conversations about money with the people you support, and importantly, get them to the right sources of help for any money issues they might be facing. The ultimate goal is to improve their financial well-being at the same time as improving their mental health. So I am so passionate about the opportunity here. And when we were putting together the strategy, I really advocated for putting that cross-cutting theme around mental health, and then also scrabbled around, many of you will be able to relate to this, to find the headcount to be able to set up a little team looking, and Sarah Murphy is the head of that team, looking at how to make those linkages between money and mental health and really embed this into services. So it is fantastic to see some of this come to fruition and to be here today launching a tool. So I really want to thank you from the bottom of my heart for engaging with this tool, for attending this seminar. I really hope that you'll find it useful to you in your daily practice, and also that it has a big impact on the lives of the people you support. And we want to hear from you how it's working, if it's working, share some of those stories that really keep us all doing the jobs that we do, let's face it. So again, thank you to all of you, and thank you to everybody that's inputted into this tool, which is actually a really amazing example of collaborative working with multiple different organisations. So thank you all, and now I am handing over the reins to Levi. Thank you very much, Levi, and thank you to everyone else that's speaking on this call. I should say as well, I'm going to have to duck off because I'm in the middle of a board strategy day, so I will listen back to the recording afterwards, but I won't be here at the end for a Q&A. But thank you very much, everybody. Over to you, Levi.
Good morning, everybody. As Sarah said, I'm Levi Buckley. I'm one of the executive team with the North East and North Cumbria Integrated Care Board. And for people not familiar with integrated care boards, this is the central hub of the NHS for the North East and North Cumbria. So we work with all of the hospitals, all of primary care, and then our voluntary community enterprise sector partners to make sure we discharge our responsibilities to have the right services for people at the right time in the right place. I joined the board in May, so this is just week 3 for me. But one of the responsibilities I have is around the development, transformation and delivery of mental health services, including those services for learning disability people and autism. So I genuinely was delighted to be asked to join you today for the launch of the tool. As Sarah said, it was really nice partnership with the Integrated Care Board, and the board really pleased to support the development of this work with our partners and with those of you who've joined us today. And really our aim today is to raise awareness of the signposting tool as far and wide as possible. We think the tool will make a real difference across health and social care, but also more broadly with our partners in the voluntary sector, to direct people to the right support, the right local services, and really to help mitigate and reduce the exacerbation of mental ill health on individuals, families, and communities. Sarah's already touched on the development of the tool, and you'll have seen on the agenda, colleagues are going to give you a bit more detail, so I'll not get too much into that. But when I met some of the team last week involved in the development of the tool, what really struck me was that degree of collaboration, particularly working with Mind and Rethink and people working in this field directly with our communities, so that hopefully we've developed something that really recognises and understands what people's needs are and where those gaps are in knowledge. So particularly for our clinical and non-clinical professionals working with our service users, recognising they can't know everything about all topics. So how can this help them really provide the best support for people? I have worked in mental health and learning disability services for about 20 years in my career, and seen many first-hand examples where the linkages between mental health and financial issues really cross over. And I think we probably see two key areas about that relationship between money and mental health. I think firstly, and this is where the Integrated Care Board is particularly focused, is the impact of the social determinants of health on our health and well-being. And we have really clear evidence that poverty and deprivation significantly affect our well-being and have a direct impact on the incidence of mental health in our communities. We know that some conditions, and whether we're looking at depression, bipolar disorders, anxiety, psychotic illness, all have a real impact on how people can manage their money, whether that's from affecting somebody's motivation to address their money problems. It can be it can make people want to just park it over here because it's really challenging and too difficult to address, or indeed how somebody's mental health condition might affect their financial decisions, whether that's about impulsive purchasing or whether it's about their ability to work and study. And your ability to work and study obviously has a direct impact on your ability to earn an income. And again, we know that that link between wealth and health is really well founded. So that daily impact then has a knock-on in terms of people's ability to engage with treatment plans to get the right support that can help manage their mental ill health. If you are more concerned about how you're going to pay the rent that week, that might be your prime concern. And for our mental health professionals working with these communities, knowing and recognising this and getting the right support is really critical to that holistic way of supporting people. And then secondly, we know that money worries also affect all of our mental health. They affect people's abilities to afford the basic necessities that keep us healthy and safe. We've seen both with the pandemic, the cost of living crisis, fuel poverty, and again, access to well-paid employment, all having a huge impact on people, families, and communities. And again, that daily impact of financial worries has an insidious and cumulative effect on people that affects their mental health, and we can see the impact on whole families, including children and wider family networks. So again, being able to recognise these issues and signpost people quickly to get the right support and address problems at an early stage is of a huge benefit. For our colleagues working in mental health services, it can often be a challenge knowing what's available locally to support service users and the different financial challenges people are facing. We also know people find it difficult already to talk about mental health. I think we made huge progress, but the stigma in society and in communities about talking about mental ill health, about the support and impact of it, is still a challenge. And equally, I think those conversations about somebody's financial status or challenges are also difficult to talk about. We see a lot of images in society around us of people living happy, healthy, wealthy lives. And that can be, again, insidious if you don't feel that reflects your reality. Being able to talk openly and get the right support. So again, I think this tool, as it's been built using the views and experiences of both our staff and people who use our services, hopefully is tailored to recognise some of those challenges and again help people get the right support. Obviously, knowing what's there is only the first step. What we then need to do is follow through with how we ensure people are getting access, continually evaluate and understand the impact it's had on people's experience and outcomes, so we can continue to refine and support our offer for people. So again, on behalf of the Integrated Care Board, really wanted to genuinely thank people for their involvement in helping us to develop this tool, and today being the first stage in promoting that. And I hope that you'll all play your part today to share this tool and the resources with colleagues, look at how we can promote it further. Thank you. And I'll hand over to Carleen.
Hi, morning everyone. My name is Carleen Dowden and I'm Regional Partnerships Manager for the North East of England here at the Money and Pension Service. I've been involved in the development of the tool right from the beginning, and I just briefly want to talk you through the context of where this piece of work came from, how it was co-designed and tested with regional and national partners. So today we're launching a questionnaire and signposting tool along with guidance for health and social care professionals to support them in having conversations around money with patients and to enable them to signpost to the right support. You're going to hear more about the actual tools themselves from Sarah in a couple of minutes, but firstly I wanted to provide an overview. So MAPS were initially approached by the North East North Cumbria Integrated Care Board back in 2021 to see how we might support with the work they were doing to improve access and standards of mental health care to support people with mental health illness to reduce health inequalities. One strand of this work was improving support for people with money issues within the mental health system. The rationale for this work was data-led, as there is strong evidence to indicate that there is a significant link between financial stability and mental health and well-being. Financial stability and levels of income is a major indicator of poverty and deprivation, which in turn leads to significant differences in health outcomes and health inequalities. And these tools were designed to support the improvements in these outcomes. Working closely with the ICB, we identified that one of the barriers to supporting service users with money issues that were many practitioners were unsure of the best way to approach talking to patients about money, and also where to signpost them for money-related support should the patient disclose they needed help. In response to this, a task and finish group was formed to design the tools to help overcome this barrier. Partnership was key to driving this project, and the task and finish group was made up of partners including Rethink Mental Illness, the Mental Health Policy Institute, Public Health England, Cumbria Northumberland Tyne and Wear NHS Trust Individual Placement Support Employment Team. Representatives from these organisations all kindly agreed to be part of the group and to give their time, to experience and expertise to help develop and critique the tools. Once developed, we ran a pilot, and during September and October 2022, the tools were tested by Sunderland and South Tyneside NHS Foundation Trust, who carried out interviews using question framework and signposting tool with South Tyneside life cycle mental health service users. Following the interview, service users were asked if they would be happy to complete a questionnaire about their experience. A questionnaire was chosen as it offered an anonymous way of feeding back, and a paper and online format supported accessibility. Patients were asked questions including how they felt about being asked about their financial situation, how honestly they felt they were able to answer, whether they would have liked advance notice about the interview that was taking place, what they thought of the questions themselves and the length of the interview, the accessibility of the signposting information, their understanding of what would happen next, and lastly, the impact of the interview. Additionally, as part of the test stage, staff from Mine, Tyneside and Northumberland provided their views on the tools through participating in focus groups to provide their own feedback and that of clients. The pilot was independently evaluated by Involve North East, a research organisation in the North East who have vast experience in gathering the views and opinions of patients, carers and the general public in relation to health services. Taking on board the feedback and recommendations published in the evaluation, further work has since went into adapting the tools to produce the final versions that we're launching today. In addition to the original version that was designed to be used in healthcare settings here in England, we have now also produced versions that can be used in Northern Ireland, Scotland and Wales. We are delighted to be able to offer the tools to health and social care organisations across the UK, and we'll hear later from Catherine from the ICB, who will talk more about the types of organisations that might find the tools useful. But now I'm going to pass you over to my colleague Sarah, who's going to go through the actual tools. Thank you.
Thanks, Carleen. Brilliant overview of all the work that's gone into this tool, and just highlighting again what Levi was saying about the collaboration across all these different organisations. So my name's Sarah Murphy, and I'm the Senior Health, Social Care and Welfare Systems Strategy Lead here at the Money and Pension Service, and I've been involved in the development of this tool over the past couple of years. So what are we actually launching today? Well, we're going to be launching 2 documents that they will be made available to you, and they're going to be hosted on our website. So the first document is a guide for you as mental health professionals, and the second document is the questions and the signposting tool itself. And although you can see on the picture on screen there a picture of the document that says signposting for England, as Colleen mentioned, there is a version for each nation of the UK. So when you get sent the link to the tools, do make sure you download the right one. So in terms of the guidance for mental health professionals, we developed this document off the back of the evaluation and the feedback from testing the first version of the tool. Because what came up during that process were a number of questions from the mental health professionals, and also from the service users who'd been asked those questions. So some of the questions include, why should you use this tool? Levi's already touched on those links between mental health and money from both sides of the coin, whether it's mental health issues impacting on money management, or whether it's money issues which are then impacting on mental health. So there's a bit of an explanation and some data around why we think it's important to embed these kind of money questions within the mental health pathway. Other questions include sort of when might you use it, and really that's probably up to you guys as professionals and will depend on the service that you work in. It might be that you're in a service that when someone joins, you do a full assessment and you ask a lot of questions. It might make sense to include it there. It might be that it's more appropriate to ask these questions when you've built up a bit more of a relationship with the person that you're working with, or perhaps when they mention that money might be an issue for them. I know myself, having worked in health and social care previously, that a number of voluntary sector organisations sometimes use the recovery star. So it might be that you want to use these questions when you're exploring the different life domains of somebody, and particularly that kind of financial element. Some of the feedback that we got from the service users was that they would have liked a little bit of notice that they were going to be asked these questions so that they could be prepared. And some of them also questioned about whether or not the information that they were providing would be recorded. So again, we addressed these kind of questions in the guidance document. So onto the tool itself. So once you've read the guidance document as a professional, hopefully you feel prepared and you understand how to use it. And when you open the actual questions and signposting tool itself, there are about 12 questions which draw out a range of different money issues that somebody might be experiencing. What we do stress at the very beginning, and what we suggest in a form of wording at the very start of the tool, is that you do make it clear that you're not a money advisor and that you can't give any advice about the person's money situation, but that if you can explore the different types, or if any of money issues they might be experiencing, then you can get them to the right sources of support for those different issues. So we really stress that you're not there to be money advisors, and this is really a tool to explore the issues and get someone to the right sort of advice for the money problem. The tool then goes through, it's about 12 different questions covering a range of different money related topics. As you can see, The first question is a general one there around whether or not any money issues are impacting on mental health. And depending on the answer that the person gives, you can either just move on to the next question if that particular one isn't relevant, or if it is relevant for that person, we then provide some suggested wording and a range of national tools and resources and services that you could then share with the person that you're working with. So the questions cover everything from whether or not the person's fallen behind and is in debt, whether they've got any welfare benefit issues that they need support with. We cover off more emergency situations. So do they have enough money for food? Do they have enough money and somewhere to live? Are they able to afford to heat their home? But feedback that we got from the first version of the tool was that actually sometimes people aren't in financial crisis, but there are broader money worries that they have, which might be nagging on their minds. So we also included in this version more questions around general household finances, whether people need support with budgeting, whether they might need any guidance about pensions, addictions, spending money on a range of addictions, whether that's gambling, drugs or alcohol, whether they are concerned that they're at risk of being scammed or having experienced some sort of financial fraud, and also whether they are in a situation where they've perhaps been coerced into debt or having their finances controlled by others. So the money related topics are quite wide ranging, and again we provide wording for each of them, and then also those national services, tools and resources that you can then signpost to. Again, please do download the right one for your nation, because those national tools and resources are different depending on whether you're in Northern Ireland, Scotland, Wales or in England. And although we tested the tool and worked with the team in the North East to develop the first version, for this version that we're launching today, we obviously want to make it applicable for everyone across all parts of the UK. So what we've done is we've included this, what you'll see is this blue column when you get to the tool, and the document is editable. So you can take that tool, save it to your system, and you're able to type into that blue box any local services that you know of that also might be able to help that client. Because it might be that you've already got really good referral relationships with a local citizens advice, a local Christians Against Poverty, a local food bank or food pantry, local drug or alcohol services. So the tool allows you to add in the details of those services, so you've then got a comprehensive picture of all the support that's available both nationally and locally. So the tool itself is going to be hosted on the Money and Pension Service website, and the version for each of the 4 nations and also the Welsh language version will be there, and the guidance document for mental health professionals will be there as well. But for those of you who've registered for this event today, we're going to be emailing you the link to the resources as well as the video afterwards as well. So if you've had to drop off early, you can catch up, and we'll be sending you the tool itself directly into your inbox. But that's everything from me. I'm now going to hand over to Catherine Richardson, who's going to talk a bit about using and embedding the tool.
Hi, morning everyone. So I'm Catherine Richardson, a Senior Programme Manager in North East North Cumbria Integrated Care Board, but specifically have a lead for population health management for mental health and learning disabilities, and also suicide prevention. So I can see in the chats there's some areas around data that potentially we can answer and come back to if that's what we need to do, and I'll leave my contact details there as well. So as we can see through those presentations, there's a definite link in terms of reducing health inequalities and the impact of financial well-being and on people's mental health. As an ICS, as we've heard we really wanted to get under that relationship and work through how we could support people with their financial well-being who were specifically in contact with mental health services. But I think as we started to broaden that out, we can see from the slide that I've put on there that we piloted it in the IPS, so the individual placement support services, which is the employment support within secondary mental health care, and also talking therapies, so the what was used to be IAPT, and alternative to crisis services, which are provided through our voluntary sector in the North East North Cumbria. So it's piloted in different settings. And I think the experience has been different across those, depending on the level of skill set of the workers. In some cases, they piloted that in a group setting. So certainly within our alternative to crisis services in the VCS, they did some work in groups, so which was really interesting, and then went on to do it as an individual one-to-one, so raising financial issues in groups. We haven't carried that out in primary care, and I could see one of the comments in there. It absolutely is suitable for primary care, and we've shared it with GPs in the area. But what we haven't done is piloted it with GPs in the area. So we're really interested to see if people will take that on. In terms of public health and local authorities, we've absolutely embedded and connected with our public health colleagues in local authorities, and obviously the services that they commission through local authorities as well provide us with a great opportunity to share the tool. But in terms of commissioning services, if there's commissioners on the call as well, we've looked at using our service development improvement plans as a way of embedding the tool through our providers. In terms of workforce, there's a clear link for ourselves. We're all going through the same cost of living crisis as our population groups. So it's really useful for our own workforces within the NHS and social care and beyond, as well as our population. We are suggesting that once you use the tool, that you start to link back to your MAPS colleagues. So as Carleen is ours in the North East and North Cumbria, and Carleen's been great in supporting us and working with some of the providers to provide small group guidance around using the tool. I'm volunteering MAPS here, of course, but of course MAPS colleagues in each of the areas will be able to do the same. Okay. So in terms of call to action, we'd really like to hear about how people will be embedding the tool, taking forward the tool, and any examples that we could share, probably through a community of practice, and hopefully we'll try and get an area on the NHS Futures site so we can start to learn and get that feedback. Yeah. Now, if we can go on to questions. I think we've got a couple in the chat, and thanks to all our speakers so far. The first one that came through was around data. So do we have the data that suggests the impact on poor finance poverty on mental health of individuals? And if I can ask our speakers to come back.
Yeah, I'm happy to start that one off.
Thanks, Sarah.
So there's quite a bit of data out there about the links between mental health and money, as Levi was saying earlier, both from the side of things where people who might be living with a mental illness, perhaps, there's evidence around the difficulties they might have because of certain symptoms of their conditions that might make managing money or making decisions about money a bit more difficult. But also there's evidence about the fact that living with a money problem or living in poverty, having to make really difficult decisions about what you can spend your money on day to day is very stressful, and long term can then have that longer term impact on mental health. In terms of sort of hard statistics, we know, so every 3 years at the Money and Pension Service, we do something called an adult financial wellbeing survey, where we ask questions to thousands of people across the UK about a range of different issues related to finances, everything from how confident do they feel managing money, are they struggling with bills and payments, are they able to save regularly, are they being able to think about their pension. So it covers quite a broad spectrum of money issues. And we know from the latest survey data that about 50% of the adult population in the UK did tell us that they were struggling with bills and payments. And bear in mind that this was in 2021, so before kind of cost of living started to bite. But when we look at that data set and we take the people who'd also told us that they had experienced a mental health problem, that figure goes up to 74%. So we know that 74% of people who've experienced mental health problems are also struggling with their bills and payments. We also know that about 50% of people who are in problem debt are also experiencing a mental health problem, and that's taken from analysis from the Adult Psychiatric Morbidity Survey, and that analysis was done by Money and Mental Health Policy Institute. And sadly, there's also evidence that about 13% of people who are in problem debt also contemplate suicide. So lots of sort of statistical data, as well as, I guess, more those case studies of people that you come across day to day, of those links between mental health and money.
Thanks, Sarah.
I think just to add on another data source that was kind of really crucial in firstly shaping and scoping this work was a piece of work that the ICB and Public Health here in the North East had commissioned. MMC carried it out, and it was around suicide prevention and those kind of clear links between suicide and kind of money and mental health issues.
And that's certainly reflected in the National Strategy for Suicide Prevention, and we're expecting the refresh version of this next couple of months. And from the presentations we've seen through Lewis Appleby, the financial impact, cost of living, and the relationship to suicide is going to be quite strong through that strategy. So it's worth keeping an eye out for that as well.
Yeah. And I guess, yeah, that's particularly for England. I know we've got some colleagues on the call from Northern Ireland, Scotland and Wales. So Scotland have already published their suicide prevention strategy, and there's definitely recognition of the impact that poverty and sort of those wider determinants of health play on mental health. And I know that in Wales, they're about to refresh, I think, their strategy, but their previous strategy also, recognised that money was an issue. So it's a key issue across the UK as well.
And I just thought, I mean, as others have said, there's a lot of data our our public health colleagues can provide on this, but generally we know that the fifth most deprived areas tend to have twice the level of incidence of mental health mental ill health, whether that's from the moderate, more anxiety, depression, but also with the more serious illnesses that can have a real impact on well-being. So I think there's a really good set of data there, and I'll feed this back to the Integrated Care Board of how we share some of that more publicly.
Catherine, there was a couple of questions there that I might be in the chat. So one of them was around, is the evaluation public? Yes. I believe that is housed on our financial capability portal, so I can share details of where that can be found. And also a question around, could the tool be used with Job Centre Plus? So actually it is something on our list. We work closely already with JCPs on, a lot of them have been testing our Money Advisor network, which is where people can be referred and get an instant call back from a debt agency. So I think this certainly kind of complements it. So it's something that we will be talking to JCP about as we kind of extend the work we're doing around the Money Advisor network.
Yeah, and also just adding to that point as well, we haven't talked about it today, but again, it's available across the UK at the Money and Pension Service. We have a free learning programme called Money Guiders, which is really designed for people whose job isn't to provide any kind of money advice, but is there to kind of raise awareness of the different types of money issues that people might be having, and being clear about the advice and the guidance boundary so that you don't stray into giving any sort of money advice. So most of the work coaches across the DWP are undertaking that programme, or will be, and also the employment advisors within talking therapies in England they are all going to be doing that programme as well. So we think this tool is a really nice complement to doing that money guiders learning, because many of the questions that we cover off in the tool are sort of covered off in the training, so the two kind of go quite nicely hand in hand.
There's also a question around there, has this been helpful in identifying gaps in services? So I know Lucy's on the call, but we have been working with the suicide prevention group, so representatives from all the local authorities from public health. And what we've actually formed here in the North East is a list of services for every local authority area. So the idea is now that those have already been compiled, and where Sarah showed you can drop in local resources, local links to services. We're already in a position here in the North East. So I think in terms of identifying gaps, it has been helpful. I suppose then it is the kind of lead of local authorities or other providers and things to potentially look where the gaps are as a more broader piece of work. But yeah, I think it has been helpful in focusing people in on what support is available.
Thanks, Carleen. There was just a question there around most clients do not engage or are embarrassed to contact the relevant organisations, and that the bigger issue around the lack of adult social care and generally only getting help if people were sectioned.
Yeah,
so I think,
sorry,
Levi,
Catherine.
No, that's great.
Yeah, I've seen those comments from Lauren. I think it's a really well-made point, and I think that recognising both the level and severity of people's financial worries, but also the level and severity of their mental ill health will absolutely have a direct impact on the way they will engage. So, you know, I think we're not promoting this tool as a panacea for everything. It won't fix the underlying problems, whether that's about somebody's financial circumstance or whether it's about whether they're able to access the right treatment to address their mental ill health. So I think there's learning as we use this over the coming months of what we need to do to make sure its reach is as strong as possible. But Lauren, I think it goes hand in hand with a whole raft of work, which is about training and awareness raising with teams who are supporting our clients in terms of how to have those conversations, how to encourage and support people. And you know, you mentioned there about the challenges and pressures in adult social care. You're absolutely right. We know there's you know, in terms of not just the impact of cost of living, but austerity on the range of services. So I think we have to see this as part of a wider toolkit of how we support people and communities.
Yeah, and I think just building on Levi's point, people do feel very embarrassed talking about money. We know again from some polling that we did that about 91% of people who've experienced a mental health problem avoid talking about money. And I guess the hope with this tool, and we've not been able to test it on any bigger scale as of yet, but the hope is that if starting to normalise those conversations about money, we can try to perhaps reduce the stigma related to money. You know, if it's something that you're asking pretty much all of the people that you work with, and it just becomes the norm, then hopefully that kind of stigma and awkwardness and embarrassment might reduce. And I think Keith, has made also a good point in the chat, and we addressed that particular question in the guidance document. For some people, depending again, you know, where they are in terms of their mental health, a signpost and some information might be enough. They might feel able to, you know, take that on board and take some positive steps in relation to their money issue. But absolutely, there'll be people who aren't well enough to do that. And it will depend, I guess, on the role and the remit of the service and how much time you've got to spend with somebody, whether or not you're able to be a little bit more involved and perhaps make a warm referral or, you know, support that person to access those different money guidance services. So it will depend on the person and obviously and depend on the service that you're in. But yes, we recognise that some people will need more support to be able to access those money services.
Thanks, Sarah. And there's quite a few comments in terms of social prescribing and the opportunities for social prescribing. And you're absolutely right. We did have some discussions in North East North Cumbria with social prescribing networks around the utilisation of the tool, and that seemed the the most appropriate way to try and embed that into primary care and those referral pathways in primary care. So I'd be really interested to see how other people take that forward as well. Good. I can't see any more questions in the chat. Does anybody from the panel want to pick anything else up? Is there anything about when to use the tool in terms of a clinical intervention? We've talked a little bit about, and there was something coming through in the evaluation around, was it appropriate to use that time of assessment? Is there anything to pick up around that?
I don't think there's a question in the chat, but I think it is a good point because it did come up during that evaluation process. And again, I know that we've got quite a wide range of professionals on the call today, and each service will be working in a different way, and they'll be working with clients with different levels of needs, or they'll be working with them on, you know, particular in a particular format. So we haven't sort of specified or said how and when the tool should be used, but some of the feedback we got was, you know, particularly in talking therapy services, we know that at the start there's an assessment where you're asking and gathering a lot of information about that person's situation. So it might make sense to sort of build the questions in, given that you're kind of doing that wide-ranging assessment at the start anyway. It might be more appropriate to ask, you know, later on in the work that you're doing, depending on whether somebody raises money as an issue, or just depending on how unwell they are or where you are in that sort of therapeutic or clinical work. So we do address it in the guidance document, and perhaps it's something to take back into your individual services that you work in and have a discussion with your service managers and leads around, you know, when might be the most appropriate time or place to ask these questions. And Levi, I don't know whether you've got a view from your background.
Yeah, I mean, I've just been looking through the meeting chat, and there's some really interesting themes on that. And I suppose, bear in mind, North East and North Cumbria is the largest ICS in the country. So, you know, we go right up to the borders. And I see Erica and Margaret, there's quite a few Scottish colleagues on here raising some themes around training and stuff. So it will be really useful, I think, to do some cross-fertilisation of how we're supporting this. But I'll be each of the places in the North East and North Cumbria, Newcastle, Gateshead, Sunderland, etc. I'll be talking with the directors and place who are really closely working with local authority colleagues, primary care, to get some feedback on people's experience of using this, and some of those themes again in the chat about when is the right time to use it, when. And this is not just do it once and then all these problems are fixed. Even getting the right advice doesn't mean people's the impact of them on finance, on their mental health has been sorted. Some of these will need to be ongoing support and access to services that will a bit of a longitudinal journey. And I see Joe's put a similar thing there, you know, the links between food poverty and mental health. I think we're really just beginning to scratch the surface of the massive impact that we're seeing across communities, and that this is hopefully trying to fill a gap in that space. So again, as we said earlier, it's not a fix for everything, and it doesn't generate income for people, but it really directs them to, whether it's CA Advice Bureau, whether it's about ensuring that they're getting full access to the benefits that they're entitled to, whether it's about access to training, employment. It will take people down a whole different set of personalised routes. But our professionals, our voluntary sector partners, will probably need to hold people's hand through some of this to make sure that they're accessing that in a helpful way.
I can see some questions.
Back to you, Sarah. I can't see any more themes coming through.
Yeah, there is an interesting question about whether or not the tool gives a score. It doesn't. Funnily enough, at the Money and Pension Service, we are sort of working on a tool where you would be able to get a financial well-being score almost, but it would be covering that broad range of finances that I mentioned earlier, you know, right through to pensions. But no, this tool doesn't give a score. It's really just so that you can explore a wide range of money issues with a patient or service user, and then get them to the right source of support. Because a service that might be able to support them with scams, for example, is a different service, maybe where if they need support with benefits, or if they need support with like food, or a food bank voucher or something. So we've tried to cover that broad range so that you can get somebody to the right source of support depending on the nature of the money issue that they might be experiencing. And I think there have been a few comments, and I think you did touch on it, Catherine, but just about sort of the naming. So we tested it in mental health services, and obviously this is where the need came from, which is why we sort of focused it there. But absolutely, it's for voluntary sector providers, it's for primary care. If you're working with anyone where their mental health might be impacted by money, or money might be impacting on their mental health, then the tool will be useful for you, and you can ask those questions and get people to the right sources of support.
And I think it's worked really well in as we start to roll out alternative to crisis services more consistently. It works really well in those environments, because as we know, not all crises per se are a mental illness crisis, and a lot of much more around financial relationship breakdown and so on. So this tool becomes really handy in those environments, I think. I'll hand back to you, Sarah.
Yeah, I think we've probably covered most of the questions. Apologies if not. It's difficult for us when we're presenting to scroll through and try and read everything. But huge thanks to everyone for joining today, and for letting us take up about 45 minutes of your time. We really hope that you will use the tool and that you will find it useful, but we're also very open to feedback. So if you are using it, and you've got some case studies, or if you've got any ideas as how maybe version 2 could be improved, then we want to hear about that. So please do email us at partners@maps.org.uk if you do have any feedback. But both the recording, the links to the tools themselves, and also the email address for any feedback will be coming out to you via an email. So thanks again for your time, and we really hope that you'll find the tool useful to be able to embed financial well-being in the work that you're doing and improve overall well-being. Thank you.